Hello, I am Tyler Harrell. I'm a podiatrist that works for the Avera Medical Group in Brookings, South Dakota, and I also do surgical procedures and other medical care at the Brookings Health System Hospital. My specialty is a podiatrist. I also, people refer to us as foot and ankle surgeons as well, so I do surgery as well as the podiatry side of the foot and ankle and the lower extremity. The ankle joint is most commonly known as a hinge joint. Most people view the ankle joint as the joint that goes up and down, dorsiflexion and plantar flexion. The ankle joint is a lot more complicated than just those two motions. There are side-to-side motions, the subtalar joint of the foot and the transverse tarsal joint of the foot, as well as what's called the tibiotalar joint, also makes up the ankle joint. So it's a very complex structure made up of many ligaments, muscles and tendons that go across the joint that help to stabilize it. So it is a quite complex structure of the lower extremity. Ankle sprains are quite common in everyday life, regardless if you're a teenager all the way up through a more senior age. Ankle sprains can happen walking across the street, stepping off a curb, or playing an athletic sport, running. Ankle sprains can happen to any person at any time you're being active and moving along. Chronic ankle instability would be consistent and persistent ankle sprains that have happened over time. The chronic nature of these sprains are going to be more of something that's not just like a one-time thing. It's something that's happened consistently over a period of time that the ligaments have not been able to heal properly, or now not able to withstand the force and structure, or the forces that they need to keep the ankle in a more stable position. One of the most common that I hear from patients, and what we know, is that patients feel that their ankle is just unstable. They feel that when they're walking that their ankle's going to give out on them. It doesn't feel as strong. They feel that there's a weakness when they're walking, running. These patients also notice that if they're on uneven ground, such as running in grass or doing trail running or just even walking up steps, sometimes they feel that their ankle doesn't have the strength to get them where they need to go as quickly as they would hope, or just the fact that it's not as stable as it once was. The unstable feeling is probably the most common thing that we hear. Conservatively, we do treat chronic ankle sprains with ankle bracing. We can try physical therapy to help to strengthen the ligaments and the tendons, as well as the ankle joint, to keep it a little bit more solid for the patient so they can do their activities normally. We do use NSAIDs, or anti-inflammatory medications, such as ibuprofens, Aleve, other prescriptions. Meloxicam is another one that is commonly used to help with getting rid of swelling, as well as trying to help decrease some of the pain. Once we've tried conservative treatments and patients aren't having the results they would hope for, and we're not seeing the results as physicians that we'd hope for, we can go to surgical procedures to help to strengthen and reconstruct the ligaments that are damaged. We do an incision on the outside of the leg. We try to make it as small as we possibly can, always trying to be as minimalistic as we possibly can. And we go in and we dissect down, we find the structures that are damaged, and we find the ligaments that need to be repaired. And we use medical devices, anchors, other things that we have in surgery to essentially reconstruct and try to recreate those ligaments using medical devices. We also use the patient's native ligaments, and if we have to, we'll use tendons if necessary to make those ligaments and stabilize that ankle to make it stronger for the patient. Right away, they're going to be in a posterior splint. They're going to have a big bulky dressing on. This dressing they leave intact until I see them in their first post-op visit, which is generally a week to 2 weeks after surgery. We keep them non-weight bearing. They use crutches or a walker or an assistive device such as like a scooter to get around. They can move around, but generally the first few weeks people don't feel that well to want to be getting up and going and doing a ton of things. But for the most part, they're non-weight bearing with the use of an assistive device, taking pain meds as necessary, and we try to ice and elevate as much as possible. After the first few weeks, when the ligaments have healed and we get to what we know of healing and we tell with clinical exams, we get them into an ankle brace, and we try to transition from non-weight bearing to partial weight bearing to then full weight bearing to allow them to kind of get used to walking again, because they don't walk for a few weeks, and we got to kind of train our bodies to, now that this has been reconstructed, they have to kind of feel out what is going to be okay for them to do, and we try to get them back to activity as soon as possible, as safely as possible. You know, we think of children, you have to learn to crawl before you walk generally, and then we run. So we want these baby steps into a sprint is what we're kind of going for. I've worked in a number of different hospitals, and I've worked for a couple different hospital systems. And the people and the staff that I work with on a daily basis are always there for the patient. It's nice to know that when I come to work every day, the staff that I work with is there for the right reason, and they are taking care of the patients in the best way that they possibly can. I do feel that Brookings Health System is a great hospital system for that. I myself, as well as the people I work with, are always trying to get people back as fast as possible in the safest way possible. And I just think that this health system is here for the right reason. I feel that they are doing what they can to make people get better in a good and timely fashion.